Hi, I'm Dr. Jack Ringer, and I'm here at Keating Dental Arts today to do a demonstration on a few aspects that are all important to us in our practices. So let me talk about impressions in the front, and then we'll actually do an impression in the posterior. In dentistry, if we are doing a single tooth, all right, impressions are relatively easy, okay? We can record a bite very easily because we haven't disrupted or changed that. Patient can easily find that bite when you record. But when we're doing the front teeth, what's super important is that when you capture whatever impression you're doing, you have the contralateral tooth in that impression. This is important so they know what shape and size to do. So for instance, if I was prepping right now Diane's upper left cuspid, number 11. I need my impression to have the opposite cuspid in it, number 6. Okay, I have the photograph for the shade, and I'd have the other teeth adjacent for the bite, but I also need the other tooth, number 6, so the lab knows exactly the size and shape of the contralateral tooth. All right? If you're doing multiple units in the front, doing a quadrant tray in the front, which would be something like this, okay? This is a triple tray, which we're going to use for the posterior in a minute, but a posterior tray in a minute like this, okay? This would be really good if I'm just doing one, maybe 2 teeth in the front. You can see if I put the impression material, it's going to capture a lot of teeth along with the bite and the opposing. But if I'm doing 4 or 5 units in the front or more, you need to take a full arch tray, all right? Not triple trays. A full arch tray, and then a full arch opposing tray, and then a separate bite. Otherwise, the lab is going to struggle articulating the preparations, getting the relationships of size and shape, and that will end up reflecting only badly on your practice if it comes back and it doesn't look really good. So what I'm going to do is I'm going to put her back in a second. We're going to take our light body impression material and inject it gently around that tooth, starting from the gingival area, work and pulling upwards to avoid bubbles. And then we're going to take our triple tray, which will have our heavy body material on either side. We will insert it in the mouth and kind of vibrate it very gently right there, again, to try to eliminate bubbles. Have the patient bite gently until they feel all their teeth coming into their centric occlusion. And we just have them sit there and we don't move it.
Keating Dental Arts.